Health Minister Dr Joe Phaahla today met with MECs as part of the National Health Council to discuss the state of public health systems in South Africa. Now, the meeting also reflected on a number of issues impacting the provision quality of healthcare service in the country, including medico-legal claims, as well as cost containment measures announced by the National Treasury, and mitigating factors, including the introduction of new vaccines, the risk level of avian influenza infection on humans, the expansion of online birth registrations in health facilities, maternity and neonatal care guidelines, amongst many other issues. So to take this discussion further, the state of South Africa's healthcare system coming to the fore, we are going to be joined via Teams by Russell Rensburg. He's the Director of Rural Health Advocacy Project. Russell, good afternoon, and thank you for your time with us here on the SABC.
Good afternoon, and thank you for the opportunity.
Russell, South Africa remains one of the most unequal access to quality health care. And at this point, how do you think we should be going about managing and mitigating against this problem? Is NHI the answer for you?
Yeah, look, the NHI is not the panacea to all problems experienced as a health system. But I think it is a step in the right direction because it provides like a legislative framework for us to sort of address some of the gaps that we've experienced over the last 30 years in the provision of publicly funded healthcare. So in the first instance, obviously, as you know, the minister is meeting today with the MECs and the provincial HODs to discuss the health system. But in the current regulations that cover this, like the National Health Act, how the National Department of Health coordinates with the provinces isn't clearly defined. So at the moment, even though we have one country, we have 10 health systems. If you include the private sector as a separate one, and we don't actually have a mechanism to jointly determine which priorities we will focus on, nor do we have a standardized way of approaching how we are progressing on those things. Right? And I think that really puts us at the back foot, particularly at a time when we are resource constrained. Because now more than ever, we need to get better bang for our buck.
No, thank you for those sentiments, because at this point, I wanted you to then chat about some of the barriers to South Africa's healthcare access and some of the factors influencing the preparedness for the implementation of the proposed NHI then.
Look, I think in the first instance, obviously, when we judge national health, we should judge national health and population health outcomes, right? So those are the ones that apply to everyone. So within the UN SDG 3, which covers health or universal health access or coverage, they mention 3 broad disease priorities. Now, the first is obviously improving reproductive and maternal child health services. The second is a better response to infectious diseases. And the third one is really beginning to address the scourge of non-communicable diseases. Now, in the first 2, South Africa has actually really progressively done reasonably well. Our maternal mortality rate has gone down, our infant survival rates have gone up, our vaccination rates have gone up, infectious diseases is a similar pattern with HIV. But on other issues like TB, I think we're having a lot more challenges, particularly as there's still a number of patients that don't make it to the system. So in the current arrangements, we can't have a national plan. We can have a national plan, but it's implemented by provinces and there's very little room for coordination. So I think one of the first things that we need to do in preparing for the NHI is really investing in proper health management information systems that can help guide us in making the right decisions that will influence better population health outcomes, particularly for those who are left behind. Because even if you look at existing data, there's lots of variation in health system outcomes between districts and even between provinces, with the poorest districts, particularly rural ones, often performing the worst. Not that healthcare is only determined by health access, because a lot of that is socially determined. And as you mentioned, South Africa is one of the most unequal countries in the world where income inequality is measured.
Well, Russell, I actually wanted to pick up on the vacuum of communication and even the data emerging, what your opinion was on that. And you did touch on that. There was even a NHI pilot study that was conducted between 2012 and 2017. And some are still questioning, the thorough outcomes of what was reflected on that front. I wonder, at this point, given some of the issues flagged by the Auditor General, there have been some medical claims that have skyrocketed to billions of rands. There was a figure that had been alluded to, about 125 billion rand. And I wonder if you could talk to us about the impact that is having on funding public healthcare sector at large and service delivery.
Sure. that's like the 10. A lot of the provinces, and particularly the poorer provinces, are struggling with the management of medical legal claims. And really the quantum of those claims is probably the first thing that we need to try and address. Right? I think the Eastern Cape Department of Health were recently successful in putting forward a public health defense in response to a medical legal claim. Because some of the big challenge is not necessarily that the department must avoid taking responsibility for where it makes mistakes, because I think that happens everywhere in the private sector. Adverse events is one of those things that happen. But the problem with medical legal claims is the way that they're calculated. So when a case is brought against the state, and the state is held vicariously liable for all the actions of its workers, the remedy for that case generally requires budgeting to provide the victim of the adverse events with care in the private sector. Right? And that pushes up total cost of the claim. And I think what the Eastern Cape have done well in their defense was say that, look, a lot of those services can actually be offered within the public sector. It reduces the quantum of money that needs to be paid up front, which often benefits the lawyers more than the patients. And I think there's a lot more conversation that needs to that the Legal Practice Council needs to get involved, is in the extent to which it oversees lawyers that manage these beneficiary trusts for victims of medical negligence. Because in some cases, they found that a lot of the time that money often doesn't reach the people it should. What is the impact that it has on publicly delivered services? At the moment, I don't think provinces make enough provision for medical legal claims. And the result is that they're not necessarily budgeted for, because they say they don't really have a sense of how much they're going to pay in a given year. So budgets are given annually. So every year, provincial health departments get a new budget. So if they don't explicitly plan for medical legal claims, which can be up to 10% of their total budget, the result is that money gets taken away from other services, and paradoxically it creates an environment for more medical legal claims. So I think in the Public Liability Bill that's currently before Parliament, they can address some of these issues. But until then, the payment of medical legal claims really undermines the state's ability to deliver quality healthcare services. And that is something that they need to address urgently.
Russell, I have to end the conversation. Just very quickly, the basket of services that's an offer in NHI, what are your thoughts? Because we're trying to balance cost as an issue, but obviously also looking at efficiency and technology. How do we begin to build some of the health technology assessments, benchmark it against international best practices? Is there also concern that the minister and the advisory bodies that will be overseeing NHI have too much power concentrated in their hands? Walk us through what you're observing on that front as we end this conversation.
Look, again, I think you're asking me all the million-dollar questions. At the end of the day, is really what are the problem that they try and solve, right? So we want to have, as a country, I think we should have consistent access to healthcare services, be it public or private. So even in both the public sector and the private sector, you don't have a consistent guaranteed package that's available to you. In the public sector, 9 different provincial administrations organize their care in separate ways relative to their needs, and often not meeting everybody's needs. So if you look at publicly funded healthcare services, even in the Western Cape, where it runs relatively well, if you're a worker at ShopRite, who earns very little and you can't necessarily afford a medical scheme cover, and you're reliant on public services, you're not able to access them in the way that you need them, right? Because those services are designed to deal with basic healthcare issues, and not necessarily the kind of GP that you need to see if you need to get a sick note or you need to be treated rather quickly to be able to get to work. So we need to address that. The second thing is that in the private sector, you have over 80 schemes, and within that schemes, probably a number of other different plans. Each of those plans offering different packages of care. So whether you have consistent care access to the care you need is also not clear. So I think the first thing that we need to do is optimize the money that we're spending in the public sector by prioritizing it around district health services, including primary care, and contracting in some private capacity to ensure that all people are able to access publicly funded healthcare. And on the private sector side, I think we should also look at introducing one universal, comprehensive package that all schemes must cover, and then they can compete on price. But it's not an easy job, right? I think at the moment we actually have quite good access to healthcare, but it doesn't necessarily meet all the requirements of access, particularly on issues of coverage. So I think this is a very long conversation, and everybody needs to be involved, not just the government. I think the private sector are important players, as are civil society organizations and communities in large, because health, unfortunately, covers all struggles, and health is everybody affected by it.
Well, Russell, the devil is in the detail, and there are unsustainable practices in both public and private sectors at this point. So we'll obviously have to navigate through ensuring that there is transparency. But we'll leave that conversation there for now. Thank you for your time with us on the SABC. Russell Rensburg, Director of the Rural Health Advocacy Project, weighing in. We saw that Dr. Joe Phaahla, the Health Minister, has been meeting with MECs to discuss the state of public health systems in South Africa at large.